I want to get into some other issues now, because we know over the weekend some private hospitals could be forced to shut down over coming weeks after the government's decision to ban, and rightly so, non-urgent elective surgeries. The shutdowns could see thousands of healthcare workers stood down from their jobs. Dr. Rachel David is the CEO of the private Healthe Care Australia, and she joins me now. Thanks very much for your time, Dr. David. I know that this is an allied area to you. You represent private health insurance companies, and we'll get to some big moves that you've made in that sector over the weekend. But I've got to ask you about private hospitals. There were reports on the weekend the third largest provider, and I'll get the name right, Healthe Care, health with an E, care, stood down 34 hospitals, stood down 8,000 staff. It's a Chinese-owned healthcare provider because it won't, it says, get the usual revenues through elective surgery, so it won't open its doors. Now, surely this is the one time more than ever that we need every hospital available.
Yeah, look, that's right. What the state and territory and the Commonwealth governments need to do is two things. They need to ensure we have enough intensive care beds to be able to look after anyone with COVID who's deteriorated. And secondly, they need to be able to ensure that anyone who has an urgent surgical condition, like a badly broken leg or acute appendicitis, has somewhere to go where they're not actually going to catch the virus. So every state government has been negotiating separately with the private hospitals to be able to work out how many of them have got intensive care and what other capacity they need in separate, what they call clean hospitals, to do the other surgery and the other procedures that we need done. Now, that is complicated. On a couple of occasions, they've asked for federal government assistance, and I believe that there are discussions ongoing with the federal government, but under no circumstances do we believe that nurses and other essential hospital staff should be sent home. It is far too urgent a situation to allow that to happen, and those states and territories that haven't been able to move fast enough to address these complicated circumstances, but it is an urgent situation, they should do so as soon as possible.
Yeah, I think I've got some comments made by the Victorian Premier Daniel Andrews today on this exact matter. I'll play them now.
We have an in-principle agreement to stand behind those private hospitals to make sure that they're viable, and then to have all the capacity that we need reserved for any COVID-19, any coronavirus patient that needs that care. I'm really pleased to be able to report we've got a deal that sees the health system, public and private, work as one system to provide the very best care.
Dr. David, if Daniel Andrews could do this in Victoria, how hopeful are you that the other states will be able to remedy this issue, particularly, as I said, Healthe Care, the Chinese-owned company, 8,000 staff. It's a lot of staff.
Yeah, well, that's exactly right. And we don't want fully trained nurses sitting at home in the community while everybody else is running around working double shifts. So Daniel Andrews, I had heard on the grapevine by speaking to my colleagues who are working in hospitals that the Victorian government is the most advanced in terms of making these arrangements. And they've already made arrangements with some of the big private hospital groups to undertake this care. And I think he's right when he says in this emergency situation, we need to remove the distinction between public and private hospitals and just treat patients where they need to go. That's not the way we normally do business, but it's the way that we need to treat the system now.
Right, talk to me about private health insurance premium increases. They usually hit us about the 1st of April, if I remember rightly. What's going to happen this year?
Well, this year the funds will be deferring the premium increase because of the situation that we're in. A lot of elective surgery, the non-emergency surgery has been cancelled, and the non-urgent dental care has been cancelled. So we don't want to be in a situation where we accumulate any additional profits as a result of that, and so it is completely appropriate that we put off the premium increase until such time as normal activities resume, and that will be reviewed by ourselves, our regulators later in the year. In terms of anybody who has lost their job or who is working greatly reduced hours or is in any other type of financial distress as a result of the pandemic, before they even consider dropping their health cover, they should contact their health fund, because every health fund that we represent is offering hardship packages to people in that situation, so they don't drop their cover and then later on down the track when they need elective surgery realise they have to pay a whole lot more money to get back in again.
That's very good advice. And all those big funds are Medibank and NIB, Bupa and others. And I'd also make mention, your staff have told us, and this is good to know, that everyone who has a hospital policy, basic to gold cover, if they end up in hospital with coronavirus, they will be looked after. Rachel, David, thank you very much for your time.